Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and we're going to be talking a little bit more about short clinical crowns today, specifically the three causes of short clinical crowns and the whole interdisciplinary pre-ortho bonding option with a prosthodontist usually first, restorative first, ortho second. So let's talk about those three causes first. So the first cause of short clinical crowns would be wear. So usually bruxing due to airway is going to cause wear. They're going to grind them down, grind, and now they have tiny little teeth, tiny little nubbins. So in that case, the pre-ortho fix is to go ahead and do what we call the Robbins. I think it's called the Robbins technique. Let me check that again. Robbins concept. To restore teeth with short clinical crowns to their ideal anatomical shape before braces or aligners are placed, this allows the orthodontist to position brackets or make the Invisalign treatment plan based on the tooth's proper size and the patient's actual smile line rather than a damaged or undersized tooth. So that is from some literature that I read. So yes. So we talked about the severe wear option, how you restore them first, and then it's not going to be a permanent restoration. It's either going to be some composite or injection molding or just some taps or something like that, and then they'll get the permanent stuff later. Other number two cause is eruption disharmony, which is altered passive eruption, which basically is more of a gum issue, as my understanding. So sometimes the whole tooth is there, it's just buried under the gum. The gum never kind of, as the tooth erupted, it just never kind of shrunk up. Sometimes it's due to hygiene, sometimes it's just how it is, and sometimes we just have to go in there and do a little laser or whatever to remove the excess gum, and we have a beautiful tooth underneath, and it's so easy, right? So that's best case scenario. And sometimes we want to do that first so that we have enough tooth structure to be able to grab onto for Invisalign or to know how to move the tooth. Because if the tooth looks funny, sometimes you don't know how to move it or where to put it. So, and then lastly, number three would be microdontia due to just malformation. I mean, some of us just genetically have tiny little short stubby teeth. Sometimes you have one tooth that's stubby, sometimes you have many teeth that are stubby. I definitely have stubby laterals, but that's genetic. Everyone in my family has it. So I love to slap some composite on the laterals before we move them around. So those are our options. And yeah, I mean, definitely consult. Don't just rush into starting Invisalign, because if you have a tiny little tooth, especially with aligners, it's just not going to move right. So it's better to get it to be the right size. And then the patients, of course, are happier ahead of time, right? It looks so nice. So definitely consider that. If you have any other questions, check out straightsmilesolutions.com. Thanks.